This is an interdisciplinary microbiology lecture called Gastrointestinal Infections. The clinical aspects of this microbiology module will be handled by Dr. Andelin. Dr. Hillard will handle the pathology aspects of this microbiology module, while I will be handling the pharmacology. We will be discussing sample cases with specific clinical features, relevant pathologic conditions, workup, and treatment. Our general approach to these cases is not completely comprehensive, but we want to focus on some of the more important details. Here are your learning objectives. In order to diagnose, explain, and treat food poisoning, infectious diarrhea, both bloody and non-bloody, and GI helminthic infections, you should be able to do the following as relevant to each particular condition. Describe the clinical presentation, diagnostic features, epidemiology, and complications. Number 2, discuss and recognize the pathogenesis, morphologic features, including microscopic and gross findings, key laboratory features, and associated virulence factors. Number 3, describe the recommended treatment, mechanism of action of the treatment, and significant side effects.
We often hear the phrase food poisoning describing someone that has nausea and vomiting, possibly diarrhea after eating contaminated food. Typically, this has rapid onset and rapid resolution. While food poisoning is not a technical medical term, it's one that most patients and physicians can relate to. In a moment, we will be discussing 3 bacteria that can cause classic food poisoning: Staphylococcus aureus, Bacillus cereus, and Clostridium perfringens. Foodborne illness, however, is a technical medical term and describes any illness spread through food. It's a common cause of gastroenteritis, which is inflammation or infection of the stomach and small intestines, enterocolitis, which is inflammation or infection of the small and large intestines, and colitis, which of course is inflammation or infection of the colon. You will see that many of the microbes throughout this module cause foodborne illness. Now, some people use the phrase foodborne illness and food poisoning interchangeably. For our purposes today, we will specifically refer to food poisoning as those foodborne illnesses that have rapid onset with rapid resolution caused by Staphylococcus aureus, Bacillus cereus, and Clostridium perfringens. In our first scenario, we have a 42-year-old male who leaves work early after developing nausea, vomiting, and abdominal cramps. His symptoms began about 4 hours after eating potato salad at a work luncheon. Several other coworkers developed the same symptoms and had to leave work as well. He's not having any diarrhea or fever, and his symptoms resolve within 24 to 48 hours. This is an example of food poisoning caused by Staphylococcus aureus. In the case of Staph aureus, classically symptoms of nausea and vomiting with associated abdominal cramps begin within 1 to 6 hours after eating. Diarrhea and fever occur less commonly, and symptoms are usually short-lived, resolving within 24 to 48 hours. Food poisoning from Staph aureus occurs as a result of preformed toxins made by the bacteria that are in the food. Common causative foods include cold salads such as egg, potato, and pasta salads, mayonnaise, and classically, cream-filled pastries such as eclairs. Other common causes include dairy products, ham, and poultry.
Much of the microbiology presented will be a review from MOD, but we will delve a little deeper into virulence factors or biochemical reactions of the organisms covered. Remember, virulence factors are factors that increase a bacteria's ability to infect or damage tissues. You should know from MOD that Staphylococcus aureus is a gram-positive coccus, which, like all staphylococci, appears as grape-like clusters with the characteristic purple color on gram stain. Unlike Staphylococcus epidermidis and Staphylococcus saphidicis, which show white to cream coloration, Staphylococcus aureus has a distinctive golden color in its colonies on blood agar plate. Staphylococcus aureus also has the 2 key virulence factors of catalase and coagulase, which helps to identify it biochemically. First, catalase as a staphylococcus, and secondly, coagulase as the species aureus. Catalase, of course, breaks down hydrogen peroxide, while coagulase activates fibrin, allowing the organism to shield itself from the body's immune response with a fibrin shield. Staphylococcal enterotoxins are exotoxins which cause classic symptoms of food poisoning. There are actually more than 20 different distinct staphylococcal enterotoxins, with Staphylococcus enterotoxin A being the most common. Staphylococcal enterotoxins are heat stable, which can increase serotonin release in the gastrointestinal tract, causing severe nausea and vomiting, as the serotonin acts on the vagus nerve in the stomach and stimulates the medulla in the brain. Serotonin is also known as 5-hydroxytryptamine. In addition, Staphylococcus enterotoxins are considered superantigens and can, in some cases, stimulate large populations of T cells to produce cytokines, leading to severe gastroenteritis. In addition to the enterotoxins, remember that Staphylococcus aureus can create other exotoxins, including TSST1, which leads to toxic shock syndrome, a multi-system disease originally described with superabsorbent tampon use. Staphylococcus aureus can also create exfoliative toxins, which lead to scalded skin syndrome with peeling of the skin in infants and young children. Although these will not be reviewed here, you should look over these toxins before you take boards in the introductory microbiology lecture from MOD. Lastly, as presented previously in MOD, it should be noted that Staphylococcus aureus has in general a veritable armamentarium of virulence factors, which help it to inflict disease in general, including hemolysins, which destroy red blood cells and some leukocytes, leukocidins, which destroy white blood cells, penicillinase, which breaks up penicillin, protein A, which prevents antibody-mediated binding, hyaluronidase, which destroys connective tissue, staphylokinase, which can break up clots, and finally lipase, which destroys fat.
In our next clinical scenario, we have a 32-year-old female who develops nausea with vomiting and associated abdominal cramps that awaken her from sleep. Her symptoms began about 4 hours after eating leftover rice. Her partner is having similar symptoms at the same time. Her symptoms resolve within 24 to 48 hours. This is a case of food poisoning caused by Bacillus cereus. You can notice overall the similar presentation to our last scenario with Staph aureus. Bacillus cereus can cause either emetic disease, very similar to food poisoning from Staph aureus, or diarrheal disease. The emetic disease presents with nausea, vomiting, and abdominal cramps, usually 1 to 6 hours after eating. However, the diarrheal disease occurs a little later, usually 8 to 24 hours after eating, and is associated with watery diarrhea. In both cases, symptoms usually resolve within 1 to 2 days. Usually this is caused by eating contaminated starchy foods, most characteristically fried rice.
Bacillus species are gram-positive spore-forming bacteria. Remember, of the medically relevant gram-positive bacilli, 2 types are spore-forming, Bacillus and Clostridium, and 2 types are non-spore-forming, Crinobacterium and Listeria. Bacillus cereus, which causes food poisoning, is an aerobic rod, whereas the Clostridium species are anaerobic rods. In the case of Bacillus cereus, the spore allows the organism to resist the high heat of cooking, up to 212 degrees Fahrenheit or 100 degrees Celsius, which is key to the bacteria's pathogenesis. Here we see a gram stain of Bacillus cereus, complete with internal spore formation. The bacteria develops the spore forms internally and then will eventually lyse to release a free endospore. The emetic disease, characterized by nausea and vomiting, is caused by ingestion of a heat-stable toxin called cereulide, which is produced by Bacillus cereus in food. Although cooking can kill the bacteria, remember the spore form is heat resistant so reheated foods can still be contaminated with viable spores, which can give rise to toxin-producing Bacillus cereus. The cereulide toxin has a similar mechanism of action to the heat-stable enterotoxin produced by Staphylococcus aureus, in that it acts through serotonin receptors within the gastrointestinal tract, especially in the stomach. The diarrheal form of the disease typically results from ingestion of Bacillus cereus bacteria, which create an AB toxin that induces diarrhea in the bowel by increasing chloride secretion and decreasing sodium reabsorption, essentially increasing the amount of salt in the lumen. Water then osmotically follows the salt into the lumen, causing diarrhea. The B subunit of the toxin is the binding subunit that binds to GM1 gangliosides on the intestinal cell membrane, whereas the A subunit of the toxin is the active component which creates the cyclic AMP, which eventually causes increased salt production in the lumen and diarrhea. Note that this toxin mechanism is an important one to know in the gastrointestinal tract, as many other enteric bacteria create diarrhea through a similar mechanism, including Vibrio cholera, enterotoxigenic E. coli, and Campylobacter jejuni.
In our last food poisoning scenario, we have a 22-year-old female college student who has watery diarrhea with abdominal cramps. She's not having any nausea or vomiting. Symptoms began about 12 hours after eating pot roast and gravy at the school cafeteria. She's heard that several other students that ate with her also have similar symptoms. Her symptoms resolve within about 24 to 48 hours. This is a case of Clostridium perfringens. In the case of Clostridium perfringens, symptoms usually occur similar to the diarrheal disease of Bacillus cereus, with watery diarrhea and abdominal cramps that occur within 8 to 24 hours after eating. Usually symptoms resolve within 1 to 2 days. Clostridium perfringens makes heat-stable spores that can contaminate reheated meats, poultries, and specifically gravy, foods often found in cafeterias. Because the spores are heat-stable, reheating of these foods does not always kill the spores. Ingesting large amounts of spores can ultimately lead to food poisoning. This has been known to lead to outbreaks of diarrheal illness.
Clostridium perfringens is a gram-positive rod, and like all Clostridium species, it is anaerobic and spore-forming. Like with Bacillus cereus, the spores in Clostridium perfringens are able to survive cooking, especially if the food is slowly cooked. Once in the intestine, the bacteria releases an enterotoxin, which forms pores in the cell membrane of the enterocytes. Although the mechanism of action of the toxin is not important to memorize, you should know that enterotoxins are the underlying culprit to the diarrhea and cramping seen clinically. Of note, you might also remember from MOD when this organism was presented that it also causes gas gangrene and rarely necrotizing enterocolitis. Necrotizing enterocolitis caused by Clostridium perfringens is a hemorrhagic necrosis that often affects the small bowel, causing tissue death and perforation. The key toxin in both gas gangrene and necrotizing enterocolitis is the alpha toxin lecithinase, an enzyme which degrades lecithin, a component of cell membranes.
As we already noted, food poisoning can cause emetic disease, as in the case of Staph aureus and Bacillus cereus, or diarrheal disease, as in the case of Bacillus cereus or Clostridium perfringens. Note that all three of these food poisoning cases are caused by gram-positive bacteria. As most cases of food poisoning are self-limited and resolve on their own, management predominantly involves supportive care. This can include as-needed antiemetics, oral rehydration with electrolyte solution, and intravenous fluids when necessary for dehydration. Typically, antibiotics are not needed. Lastly, we've provided here a table for you to reference as you study. Note that these three bacteria, Staphylococcus aureus, Bacillus cereus, and Clostridium perfringens are all gram-positive, Staph aureus being a gram-positive coccus, and Bacillus cereus and Clostridium perfringens both being gram-positive rods. Again, Bacillus cereus and Clostridium perfringens both are spore-forming, but Bacillus cereus is aerobic, while Clostridium perfringens is anaerobic. You can reference the other aspects of clinical features, transmission, epidemiology, and pathologic features here, but please remember to reference the other slides as well.